Welcome back, everybody. I'm Dr. Perkins, and we are continuing our conversation today on how to deal with fibroids in pregnancy. If you've watched the first part of this video, we've already talked about what fibroids are and some of the risks in early pregnancy when it comes to fibroids. And so we're diving in a little bit deeper now, so come on in. So in part one, we talked about the risks of fibroids in pregnancy, wherein you may have a risk of miscarriage or bleeding in the first trimester, or you may have the risk of preterm labor and delivery. You may have the risk of having a baby be in the incorrect position at the time of birth or in your last month of pregnancy. And we've talked about having bleeding issues because of these fibroids. Let's talk a little bit more now about what to do to ensure that you'll have a safe delivery and a safe pregnancy when you have fibroids. So first off, it is so important that you have really good communication with your provider. Now, being a provider myself, I know the impact of medicine on your doctors and timing is so essential, but it's very important that you get the care that you need. And so have conversations with your doctor. Bring in questions, write them down so that when your doctor is in your presence and when you have their undivided attention, you are addressing all the important things that would make you feel as though your pregnancy is going well and you're getting the care that you need. And so ask your doctor about, where are your fibroids? What type of fibroids do you have? How large are they? Are they in the position or in an area that may impact your likelihood of having a natural birth or a vaginal birth? What are the possible complications that I may have after delivery? You know, that delivery time frame is one that is, I'm going to say, beautifully chaotic. And so with that, fibroids can actually change the way that your course looks and how you feel in the moment. So have these conversations with your provider before you get to the point of delivery. Now, during your pregnancy, the way that we monitor fibroids is by getting routine and regular ultrasounds. Ultrasounds, they're by far the best way for us to see what's happening inside of the pelvis. It's important that you get an ultrasound in the first trimester. If you can get that ultrasound by 7 or 8 weeks of pregnancy, that would be absolutely ideal. This is when the pregnancy is so small that the growth of a baby isn't blocking the view of the fibroids and the uterus inside. So you want to get that first ultrasound so you can get good images and good measurements of your fibroids and where they are. If you are not advanced maternal age, okay, meaning that you're 34 years of life and you're currently pregnant, your next ultrasound would be around 20 weeks of pregnancy. This is where we have something called the anatomy scan. This is where we look at all the organs and every part of baby to make sure that he or she is growing well. At that time, we'll also get a growth and we'll look at the uterus and any masses that might be there. And a fibroid is a mass. And so they'll take a look at this as well. This is the midpoint in pregnancy. And we know that the hormones of pregnancy may cause your fibroids to grow and change. So this is a good time for us to say, hey, we had an ultrasound around 7 or 8 weeks. We're now 20, 21 weeks. Let's compare to see how your fibroids are changing during pregnancy. Now, majority of you may notice the fibroids are getting larger. And this can be a little bit worrisome because we didn't want them in the first place, and now they're here and they're growing. It's kind of scary. But it's completely normal that due to the hormones of pregnancy, fibroids tend to grow because they love hormones. They love, love, love all the hormones that your baby loves as well. They're competing with your pregnancy and growing alongside your pregnancy, and this is normal. Now, after this special ultrasound, it's important that we get more ultrasounds to check the growth of baby, just to make sure your baby's keeping up and is thriving on the inside, and that these fibroids are not affecting your baby. And so those are called growth ultrasounds, and it's good to have them in the third trimester, which begins around 28 weeks of pregnancy. These growth ultrasounds are only done 4 weeks apart. And so talk to your provider and see how many growth ultrasounds you'll get until baby is delivered. Now, the only other caveat here is that if you're over the age of 35, you may also get ultrasounds before that 20-week ultrasound. And so you're considered high risk. And so because of that, you may get ultrasounds a little bit more often than if you're not high risk or if you're under the age of 34. We're going to talk about a few more things right now. You may be wondering, well, what do I do about these fibroids and how they feel? I might feel some pain or discomfort from these fibroids. And if that's the case, you are a little bit limited with what to do in pregnancy to help to alleviate the pain. But two things that I would highly recommend is that, one, you could always apply something that is warm or heated, like a heating pad, or a warm towel to the area that you're feeling pain. The second thing is that you can take Tylenol or acetaminophen to help alleviate the pain. I can't say that they're going to take your pain away, but it's one or two of the few things that we can do to help you during pregnancy. And lastly, I'd like to mention here that you may be thinking, well, am I able to deliver normally if I have fibroids? And the answer to that question is yes, you absolutely can. But what's important here is really talking with your doctor about where they are, where the fibroids are, that is, the size of the fibroids based on your growth and your ultrasound, and how they may impact your labor and delivery course. But know that it's completely okay for you to have a normal pregnancy, a normal delivery, and a normal postpartum period, even with the fibroids that you have in pregnancy. Just keep in communication with your doctors and ask questions. Ask as many as possible so that you are reassured and get the care that you need. And so you might be wondering, well, can't we just remove these fibroids? They're a problem. They're potentially going to cause more problems. And the question is no, we are not able to remove these fibroids during pregnancy or even immediately after. But if you haven't gotten pregnant yet and you're thinking about it and you're planning preconception-wise, then yes, that could be a conversation where we may remove them. But no, not all fibroids are problematic. If they're in a location like the outer part of the uterus, they may not cause you any issues or complicate your possible pregnancy or your current pregnancy. If they're on the inside of your uterus, they can cause a lot of problems. So I'd like to talk about some of the common risks that are really due to the fibroids, but in later pregnancy. And so the first is, know that people and females with fibroids are 6 times more likely to get a C-section. That's a cesarean section, birth. And the reason is some of these fibroids may be in the lower part of your uterus, wherein it may block the baby's descent, the baby's ability to pass through the pelvis and exit through the vaginal area. And so because of that, the likelihood of a C-section is quite high. And believe it or not, this may be the case even if you're already in labor, or even if you got to being fully dilated and you're pushing and pushing and you're giving it everything you've got, but baby is still not exiting the pelvic region. Another reason for this is that your baby might be breech. Your baby might not be in the correct position. And in 2024 or beyond, what happens is that if baby isn't head down, the safest way to deliver is to be able to surgically remove baby. And so a C-section is higher for that reason as well. One thing that I do see quite a bit as well with those with fibroids in pregnancy is that your labor may fail along the way. Imagine that your body goes through a normal process and you start having contractions that are regular and they're coming along and you know this is the moment, but then you stall. Your uterus doesn't go beyond 5 centimeters or 7 centimeters, and you've tried for hours and hours and sometimes even a day, like 24 hours, and your cervix will not dilate any further. This is quite common in those with fibroids. Lastly, I'd like to mention that placental abruption is also possible with fibroids. This is where your placenta separates from the uterus prematurely, as this should happen after baby is out. This can happen before, while your baby is still on the inside. And this could be a devastating complication because baby's life is often at risk in these moments. And so fibroids can be the root cause of this happening. Now, this rarely happens, but it's important to know that it is a true possibility. So I talk about this and so much more in this video here, and we'll dive into, when can you remove fibroids during your pregnancy? Take a look. Thank you so much for joining us for this topic. And listen, I'm sure you have questions because it's such a deep question and a lot to talk about in a short period of time. But I'd be more than happy to read your comments and comment back and help you through this journey. And guess what? If there's a specific question that you have, let's drop it below. Let's share it so that we can all learn together. I'm Dr. Perkins, a board-certified OBGYN, and it's been a pleasure talking with you today.